Hello everyone, my name is Dr. Ahmed Kamara. I'm a GP. Thank you for having me as part of the Match for Men event, and thank you for showing up. Thank you for caring for men's health, and in particularly for caring about prostate cancer. Now let me tell you about a patient, a 49-year-old man from West Africa who had been in the UK for over 20 years. He hadn't seen his GP for over 5 years. His wife encouraged him to get a routine health check. He attended looking quite anxious and nervous. Slowly, as the consultation went on, he relaxed and opened up about his symptoms. He had been waking up about 2 to 3 times at night to urinate. He also mentioned that the stream of his urine wasn't quite the same, wasn't quite hitting the back of the pan. And right at the very end of the consultation, with obvious embarrassment on his part, he said he had been struggling to get and maintain an erection. As a result, he had actually been avoiding getting close to his wife. Here's the truth. Prostate cancer is the commonest cancer amongst men in the UK, affecting 55,000 men every single year. 1 in 6 men will get prostate cancer in their lifetime. But if you're a black man, that risk is even higher. 1 in 4 men over a lifetime. As a black man, you're 2 to 3 times more likely to be diagnosed with prostate cancer, often presenting with more aggressive cancer, and you're twice as likely to die from prostate cancer. That is not fair, but that is the reality of where things are today. Here's the good news. Many prostate cancers can be cured if caught at an early stage. Early diagnosis requires you to present early with your symptoms. Early diagnosis means low grade, low stage, better treatment, and a greater chance of cure from prostate cancer. That is why I need you to hear this. That is why Countdown, the organizers of Match for Men, want to get this message across. Present early and don't wait for your symptoms to get really, really bad. If you're over the age of 45, if you have a family history of prostate cancer, or even indeed a family history of breast cancer, if you're a black man, present to your GP early if you have a change in your urinary symptoms or any symptoms of erectile dysfunction. It doesn't mean that it is prostate cancer, but you can have an open discussion and possibly some tests to rule out prostate cancer and diagnose what may be causing your symptoms. I want to emphasize, please do not be embarrassed to discuss these symptoms. As GPs and clinicians, we talk about this, we hear about this every single day. We will do our best to normalize it as much as possible, and whatever you share with us is confidential. There is absolutely nothing you can tell us that we haven't heard before. So what should you do? Your GP won't just do a PSA test, the prostate specific antigen blood test. Your GP may also want to do a digital rectal examination. That is an examination with the finger up the back passage. It takes only 10 seconds, and it is really not as uncomfortable as most people might think. It is very often very well tolerated. The important thing is both the PSA blood test and the digital rectal examination give us vital information to help us determine whether you need specialist onwards referral to see a urologist, where you may go on to have an MRI scan or a biopsy of the prostate gland. Remember, a normal PSA doesn't mean you do not have prostate cancer. Likewise, a high PSA doesn't mean that you have got prostate cancer. The combination of these tests will help us determine whether you need onwards urgent specialist referral. And that is why we have the 2-week wait pathway, whereby if a patient meets specific criteria that raises the concerns of possible prostate cancer, we can refer you so that you get seen by the specialist urologist within 2 weeks. And even then, over 90% of patients seen through the 2-week wait referral pathway do not have prostate cancer. Your general practice is at your beck and call. Use it. So here is my task for you today. Walk for your father, walk for your brother, walk for your husband, walk for your friend. And when you get home, book that GP appointment that you've been putting off. Early detection saves lives, and that life could be yours. Thank you, and God bless you all.